Okay, I have the pleasure of introducing Saryah Colbert, who is an undergraduate at UCSD. She's double majoring in global health and dance, and in her free time, she enjoys hiking, dancing, and painting. In the future, she wants to pursue a job that intertwines pediatric health care with mental health care. The name of her project is Increase in Food Insecurity During the Time of Coronavirus in the Bay Area.
Thank you for that introduction, Isabel. I've had the pleasure of collaborating with Dr. Dana Long, and our study focuses on food insecurity during coronavirus in the Bay Area. Food insecurity continues to be a major challenge in the U.S., affecting 49 million individuals. In 2018, 870,000 people in the Bay Area were food insecure. This has definitely increased because it's been 2 years, and the ramifications of coronavirus has definitely increased food insecurity, housing instability, and unemployment. Demands for food is increasing while the funds to supply it decreases. And the primary care clinic is tackling food insecurity through their food delivery farm food program. And food insecurity can lead to hospitalization, poor health, iron deficiency, behavior problems, aggression, anxiety, depression, and many, many more. So this study will address the impact that the clinic food delivery program has on patient families, investigating the food insecurity impacts on health pre and post-COVID. So this is a mixed method study collected from data from the farm food family questionnaires that I sent out. I sent out 21 patient family questionnaires and 10 people completed surveys. So for the sake of time, I'll get into the results. So we found that 100% of the 10 families used all of the fruits, and they indicated that they used 80% of the vegetables that we provided in the fresh farm food delivery boxes. And I delivered this questionnaire and had the opportunity to create the farm food boxes that will be distributed to families. And we also found that 100% of the 10 families indicated that lettuce, celery, kale, and other veggies provided are now in their diets. And also within the last 12 months, 90% of the patient families worried about running out of food, and sometimes and often had no money to buy more. So from the comments from the end of the surveys, families notified us that they appreciated the service, that they also had access to healthier diets as well as nutritional food when they were worried about running out of food. And in the future, I will be contacting 9 out of the 10 of the patient families that completed the food delivery surveys to provide them with additional resources like food banks hotline, Alameda County food banks, and more resources to connect them with EBT and food stamps. And Dr. Long also received another grant to keep going and keep continuing this program for more farm food deliveries. So thank you for listening. Any questions?
Well done. Excellent. We've had now 2 talks about food insecurity, so you should have some other questions related to that. What questions do you have for Saryah?
Yeah, I have a question. I don't know if this was in your presentation, but where is the food sourced? And overall, I just wanted to say I'm super impressed by this initiative because there's also like initiatives near where I live where that source overflow food from grocery stores, and I was wondering if this was something similar.
Thank you. It is something similar. So I created the family farm food bags at the primary care clinic at the UCSF Benioff Children's Hospital of Oakland. And we got some of the fresh food from the Alameda County food banks. Yeah, that's where the trucks came. They came in at around 8 a.m. And from 8 to 12, we'd pack up the fresh veggies, the produce. So we had celery, carrots, radish, a lot of different other vegetables, along with fresh fruit, as well as frozen bacon, eggs, and stuff like peanut butter, pasta, and other stuff like that. This was all provided from Alameda County Food Bank.
Thank you.
No problem. Thank you.
You mentioned that you received that another grant was received. I want to know how many more families would that help to provide.
That is a great question. I don't know the number of families, but all of the families receiving the farm food bags are patients from the primary care clinic. So they'll probably enroll more families into the farm food delivery program due to the grant, because it would have stopped this month, but she just received it a few weeks ago. So hopefully it'll help a lot more families.
Thank you.
Thank you.
I was wondering if there's any way, or whether, I'm not sure if you mentioned it, or if in the future for families to kind of customize what fruits and vegetables they're getting to meet their dietary needs. And yeah.
That's a great idea that I can present to Dr. Long. Yeah, that's actually, I'm writing that down. Yes, thank you. But yeah, we haven't thought about that, but that is something great to keep in mind. Thank you.